Every 11 seconds, a senior adult in the United States is treated in an emergency room for a fall-related injury. And the most heartbreaking part, most of those falls were completely preventable. If you are over 60 or you love someone who is, and you think your balance is just fine. This video might be the most important thing you watch this year. Because here is what most people don't know. Balance is not something that just disappears overnight. It fades slowly, quietly, because the muscles and systems that control it stop getting trained. And when they stop getting trained, a simple misstep becomes a serious injury. But here is the good news, and this is the part I really want you to hear: balance and strength can be rebuilt at any age. Physical therapists and researchers have proven this. The right exercises, done consistently, can reduce your fall risk by up to 40%. Today, I am going to walk you through the 7 best exercises for seniors. Exercises designed by physical therapists specifically for people over 60. They target balance, leg strength, core stability, and flexibility. And every single one of them can be done at home with a chair for support and no special equipment. Whether you have arthritis, lower back pain, or you just haven't exercised in years, these exercises are designed for you. Stay with me through all 7, because the last 2 are the ones most seniors never do, and they are the most powerful for fall prevention. Let's get started. Section 1. Why seniors lose balance and why exercise fixes it. Before we get into the exercises, let me take 90 seconds to explain what is actually happening inside your body. Because when you understand why balance declines, you will understand exactly why these exercises work. Balance depends on 3 systems working together: your muscles, your inner ear, and your vision. After 60, all 3 begin to weaken if they are not actively maintained. Muscle mass naturally decreases with age, a process called sarcopenia. Weaker leg muscles mean less stability when you shift your weight or react to an uneven surface. Your inner ear, which tracks your body's position in space, also becomes less sensitive. And vision decline makes it harder to detect hazards on the floor. Add to this conditions that many seniors already live with: arthritis, lower back pain, or joint stiffness. And every step becomes a slightly higher stakes activity. But here is the critical point. All 3 of these systems respond to training. Muscles rebuild with strength exercises. The inner ear recalibrates with balance exercises. And confidence returns when you feel stronger and steadier. The exercises I am about to show you were designed with exactly this in mind. They come directly from physical therapy protocols used with seniors every day. Section 2. Before you start, important safety notes before we begin. A few important notes. Always have a sturdy chair nearby. Use it for support during any exercise where you feel unsteady. Safety is always more important than doing the exercise perfectly. Section 3. The 7 exercises. Exercise 1, seated marching. We begin seated because for many seniors, building strength from a chair is the safest and most effective starting point. This is a core part of physical therapy for seniors. Sit up straight in a firm chair with your feet flat on the floor. Now, slowly lift your right knee up toward your chest, hold it for 2 seconds, then lower it back down. Then lift the left knee. Alternate sides like a slow march in place. Do 10 repetitions on each side. Keep your back straight. Do not lean forward or backward. Why it works. Seated marching strengthens your hip flexors and core, the exact muscles you use when you lift your foot to step over an obstacle or climb a stair. Weak hip flexors are one of the most common reasons seniors trip. This is also an excellent seated balance exercise for seniors who are just beginning to rebuild their strength after illness, injury, or a long period of inactivity. Exercise 2, chair stand. Sit at the front edge of your chair. Cross your arms over your chest. Lean slightly forward, then push through your heels and stand up slowly, using only your leg muscles, not your hands. Pause at the top for 1 second. Then slowly lower yourself back down into the chair as gently as possible. Do 10 repetitions. Why it works. This exercise directly trains the quadriceps and glutes, the largest, most powerful muscles in your lower body. These are the muscles you need to catch yourself if you start to lose balance. Research shows that seniors who can perform this exercise with good form have significantly lower fall risk. If this is too difficult at first, use your hands lightly on the armrests for assistance and gradually reduce how much you use them over time. Exercise 3, standing heel raises. Stand behind your chair and place both hands lightly on the back for support. Keep your feet hip-width apart. Slowly rise up onto the balls of your feet, as high as you can comfortably go. Hold for 2 seconds, then slowly lower back down. Do 15 repetitions. Why it works. Heel raises strengthen your calf muscles and improve ankle stability. Weak ankles are a major but overlooked contributor to falls. They are your first line of defense when the ground is uneven or when you misstep. Strong calves also improve circulation and reduce swelling in the legs. As this becomes easier, try doing it with just one hand on the chair, then eventually no hands. This progression also trains your balance system. Exercise 4, single leg stand. This is a classic physical therapy balance exercise, and it is deceptively challenging. Stand behind your chair, holding the back lightly. Shift your weight to your left foot and slowly lift your right foot just an inch or two off the floor. Hold for 10 seconds. Lower it. Then switch sides. Do 5 repetitions on each side. Keep your gaze fixed on a point straight ahead. This helps your balance system stabilize. Why it works. Every single step you take requires a brief moment of single leg balance. If that single leg stability is weak, every step is a potential fall. This exercise directly trains the stabilizing muscles of your ankle, knee, and hip. This is one of the most researched senior balance exercises in physical therapy literature, and it is one of the simplest to do at home. The goal over time is to hold for 30 seconds without holding the chair. Exercise 5, hip circles and hip abduction. Stay standing behind your chair. This time, we are targeting the hips, one of the most important and most neglected areas for seniors with arthritis and lower back pain. First, hip circles. Hold the chair lightly. Lift your right foot slightly and draw a slow, small circle in the air with your knee. 5 circles forward, then 5 circles backward. Switch legs. This gently mobilizes the hip joint and is excellent for seniors with arthritis or stiffness. Second, hip abduction. Stand tall holding the chair. Slowly lift your right leg straight out to the side, about 12 inches. Hold for 2 seconds, then bring it back. Do 10 repetitions. Switch sides. Why it works. The hip abductor muscles on the outer thigh are critical for sideways balance. When these muscles are weak, your body sways when you walk. Falls to the side are among the most dangerous because they often cause hip fractures. Strengthening the hip abductors is a standard focus in fall prevention physical therapy programs. Exercise 6, heel-to-toe walking. Now we take balance training off the chair and into movement, and this is where it gets interesting. Find a clear hallway or open stretch of floor. Walk slowly in a straight line, placing the heel of your front foot directly in front of the toes of your back foot, like walking a tightrope. Take 20 steps. If this feels too unstable to start, walk along a wall so you can touch it lightly for support. Over time, move away from the wall. Why it works. This exercise trains dynamic balance, the kind you use when you are actually moving. It forces your brain and legs to work together in real time to keep you upright on a narrow base of support. Physical therapists use this exercise to assess and improve balance in seniors every single day. If you add only one exercise to your daily routine, make it this one and the chair stand. Together, they target both strength and balance, the 2 biggest fall risk factors. Exercise 7, back stretch and core activation. Lower back pain and poor core strength are silent contributors to falls. When your back hurts or your core is weak, your posture changes. You lean forward slightly, your center of gravity shifts, and every step becomes less stable. We are going to do two movements here, a seated back stretch and a simple core activation. Part A, seated cat-cow stretch. Sit in your chair, feet flat, hands on knees. Slowly arch your back and look slightly upward, hold 3 seconds. Then slowly round your back and look down toward your lap, hold 3 seconds. Repeat 8 times. This is one of the best back stretches for seniors with stiffness or arthritis along the spine. Part B, seated core activation. Sit up straight. Take a deep breath in. As you breathe out, gently pull your belly button inward like you are bracing for a small punch. Hold for 5 seconds while breathing normally. Why it works? This activates your deep core muscles, the ones that stabilize your spine and pelvis when you walk. Most seniors have never been taught to engage these muscles intentionally, but they are the foundation of good balance and a pain-free back.